right, there we go. We're live.
Hi, I'm Jessica. So I will be arguing the affirmative side in support of applied behavior analysis as an ethical treatment approach in the ethics of treatment approaches debate.
Perfect. I am Shannon Fife. I'll be the opposition speaker, so I'll be arguing against ABA, or that ABA is unethical, or at the very least, there are some questions raised that need to be examined before participating in any sort of applied behavioral analysis treatment. It's important as RBTs, as BCBAs, and others working in this field that we're familiar with the opposition. I am an RBT, so for me it was a bit difficult to kind of step back and research the opposition, but in our field, the public may not be familiar with all of our treatment approaches, and so it's important to kind of know the questions that might be raised and what that opposition out there is, so that we're able to effectively stand against it. So for the purpose of this debate, I'll be arguing against ABA.
Thank you. Okay, so let's start out with an introduction to what applied behavior analysis is. I'm going to pull up. So the ethics, there's our intro page, and then, okay. Oops. Applied behavior analysis, or ABA, is the use of behavioral principles to cause change to socially significant behavior. There are 6 defining characteristics of applied behavior analysis. First of all, it's applied, meaning that it is used with socially significant behavior. Second, it's behavioral, so it's focusing on behavior of an individual. It's analytic, meaning that it demonstrates a relationship between the behavior change that occurs and the things that, the interventions that were used. It is conceptually systematic. This is a defining characteristic later added by Cooper, Heron, and Heward. And that just means that the interventions that are used are based on the concepts of applied behavior analysis. It's technological, meaning that the procedures that are used are defined operationally and allow for replication or analysis later. It's effective, meaning that the changes that it causes are intended and significant. And finally, it provides evidence of generality, in that it generalizes the changes that occur don't just occur in one setting or with one behavior. They move on to other things as well, in a way to be effective and assistive of the individual that they're targeting. Like I said, applied behavior analysis is a combination of research and application. It often uses single subject research design and is based on those behavioral principles in an applied setting.
All right, thank you. I will be then talking about what exactly the purpose of it and the context for this ethical debate is. Applied behavioral analysis is used in many different settings according to Bailey and Birch. As you can see there on the screen, it says behavioral analysis principles can be applied directly in real life every day for the benefit of everyone. Oftentimes people use some sort of ABA, maybe not a treatment plan, but their behavior is kind of modified based on reactions from family, friends, coworkers. Every day we exhibit behaviors, and those behaviors increase or decrease based on the reinforcement that we receive for it. Specific professional settings that ABA is used in includes nursing homes, with working with motivating the elderly to interact more, be more socially outgoing, get out of their rooms more. Hospitals, working on motivating the sick or injured with recovering. Clinical settings with disabled individuals. ABA is also used in classrooms. There's a push for school-wide positive behavioral support is a big movement in today's educational world, and that has its basis and foundation on ABA. It's also used with animals too, such as dogs that might be displaying some aggressive behavior, who have been through some trauma and need to modify behavior to be rehomed. It's used at the zoo, even training dolphins for a dolphin show. It's kind of all based on the same principles of ABA. For this specific debate, though, we're going to focus on applied behavioral analysis and its treatment and therapy as it applies to individuals who have ASD or are on the autism spectrum disorder. Services in this area are at an all-time high. There's been an increase in the prevalence, or at least in the diagnosis of individuals with ASD. And both speakers, Jessica and myself, are most experience in working with ABA and implementing ABA therapy with individuals with autism. And chances are most of our classmates and our audience for this debate are more familiar with ABA being used in that specific setting.
Thank you, Shannon. Okay, so next we're going to step into the affirmative arguments for why ABA is an ethical treatment approach. So I have 4 main arguments for why ABA is ethical. First, applied behavior analysis supports the public. Second, there are a variety of interventions and procedures within the field of applied behavior analysis. Third, the use of functional analysis and functional behavior assessment create individualized interventions. And finally, history in the field has led to a comprehensive ethical code and procedure. So first, I'm going to start out with discussing how applied behavior analysis supports the public. The first instance, first realm that ABA supports public I want to discuss is education, the field of education. There's evidence that shows that applied behavior analysis is effective not only with individuals with disabilities, but also those without. And this is an article, there is evidence of this by Didden, Duker, and Korzelius from 1997, Wise, Weiss, Hahn, Granger, and Morton in 1995, and numerous other researchers more recent as well. Some of the strong intervention approaches with strong research backing related to education specifically include direct instruction, school-wide positive behavior support, like Shannon mentioned, and then finally behavioral interventions that are based on the function of behavior from a functional behavior assessment. There is also reference to applied behavior analysis in the Individuals with Disabilities Education Improvement Act. This is calls for the use of behavioral methods from the field of applied behavior analysis with students with disabilities. Things like functional behavior assessment, positive behavior supports, and prevention of problem behavior are outlined in IDEA. And in some states, they're not specifically defined as being applied behavior behavior analytic. However, there are states that do specifically state that they applied behavior analysis interventions should be used with students with disabilities. And these, even if they're not specifically described as applied behavior and as applied behavior analysis, these interventions come from the basis of behaviorism and ABA in the field. A second instance where applied behavior analysis supports the public is intervention as an intervention for autism spectrum disorder, or ASD. In 1999, the New York Department of Health came out with an early intervention program clinical practice guideline, and it examined 18 different early intervention programs, and in the end only recommended applied behavior analysis as an effective early intervention. The National Standards Project and the National Standards Project 2 are the second National Standards Project are both research studies that examined many interventions in for autism spectrum disorder, and applied behavior analysis and interventions related to it are outlined in the National Standards Project. And then finally, as I already discussed a little bit, applied behavior analysis supports the public in its use as an early intervention for autism spectrum disorder. And that's my argument for why applied behavior analysis supports the public. So my second argument is that there are a variety of interventions and procedures within the field of ABA that are ethical with evidence supporting them. First, let's talk about just some of the interventions and procedures within the field of ABA. There's the LOVA style early intervention, discrete trial training, which is described in the National Standards Project 1 and 2 as a beneficial intervention. Natural environment training, that's another one from the National Standards Project. The Early Start Denver model, which is a research study that actually has experimental control research backing it. Then there's also the pivotal response method, which is also described in the National Standards Project. So those are just a couple of intervention procedures used in ABA with strong research backing that are ethical. And then the use, these interventions are individualized and based on client and function of specifically targeted behavior, which leads into my third point, that the use of functional analysis and assessment creates individualized interventions. So the building blocks of behavior analysts when they're working with, when someone is working with a new client, is to start with a functional behavior assessment, get to know the client, get to know the behaviors that they're exhibiting, and then based on those behaviors and the things that are going on around those behaviors, the antecedents and consequences, develop an individualized intervention, not only for that specific client, but for the specific behavior. The program for a client's behavior at school may not look the same as another behavior that they're exhibiting at home. It's individualized to not only the client, but also the specific behaviors that they're exhibiting. And then my final argument is about the history of the field of ABA and the comprehensive ethical code and procedures that has developed because of the background. There are two different examples that I just wanted to touch on very briefly. The Sunland Miami scandal was in 1972. This was an instance of gross misconduct by staff and behavior modifiers, as they were known at the time. And following this case, investigations led to the development of a blue ribbon committee. They also led to a statewide peer review committee for behavior modification. And finally, the Florida Association for Behavior Analysts for Behavior Analysis came up with the first state association and ethical code, which is a huge deal. And that was in 1972. Then there's also Wyatt versus Stickney, which was in 1974, which was another instance where an institution had gross misconduct, neglect, and abuse for its patients. And following this in the 1980s, the Association for Behavior Analysis convened and made some statements about the client's rights to a therapeutic environment and most effective treatments, things such as least restrictive environment and just client's rights, which was a huge step in applied behavior analysis. And Van Houten describes these in his article, The Right to Effective Behavioral Treatment. So those are some of my arguments why applied behavior analysis is an ethical treatment approach.
All right, Jessica, thanks so much for sharing. I do have a couple of quick questions for you here. First, starting with ABA being beneficial for the public, is that the general public, or does that include individuals with disabilities, or specific individuals with ASD?
So when I say public, I'm referring to both. The people who it's going to benefit most directly are the people who are receiving the intervention. And in this debate, we're talking specifically about autism spectrum disorder. So the clients with ASD who are receiving services are the ones who are benefiting directly in that instance. But like I discussed, when behavior analytic interventions are used in schools, it also benefits other students and in connection the entire society as a whole, because the behaviors are changing, and that generalizes to other instances as well, other environments.
Okay, so it is used with typically developing students then?
Yes. Mm-hmm.
Okay, now is there a difference in that treatment? Is the same when the school behavioral support is implemented, is a student with ASD and a typically developing student, as you said, it's used for both, but do the treatments look the same for both, or how does that work?
They do not. For school-wide behavioral support, it is a tiered intervention. So the first tier is going to target all students. The second tier is for students who are at risk. And the third are students who are engaging in behaviors that require individualized intervention. So students with ASD who are exhibiting, for example, aggressive behavior are going to have a very different intervention than the student without disabilities who is just in a general ed classroom, like a fifth grader or something. Their interventions will look different. They're individualized.
Okay, so you mentioned a bit about the least restrictive environment. I'm assuming that some of these students with ASD then are sort of mainstreamed in the classroom, or inclusion has been the word used lately, that they're directly in that same classroom, just receiving different individualized treatment. Is that what I'm understanding?
Yep. The possible in a manner that is most beneficial to the student and those around them, so that all students are receiving the best education that they possibly can. The least restrictive environment would mean inclusion when possible, as much as possible.
Okay, thank you. I have just another 2 quick questions here for you. Can you just go over the National Standards Project for me a little bit more? Just kind of clarify what that is.
Sure. So the National Standards Project was a research study that was specifically looking into the interventions, the common interventions that are used for autism spectrum disorder, as a way to put all those interventions in one place in a manner that professionals and parents could look at it and determine which ones were beneficial, which had research backing. So the study, National Standards Project 2, examined 389 studies. They looked at the research design, the findings, the social validity, the fidelity that interventions were, that had in those research studies. And it also looked at the findings, the outcomes. And they classified the interventions by strength, the top tier being established, meaning that it is an effective approach as research backing. The National Standards Project, of the 14 established interventions, 3 of those are directly related to applied behavior analysis, one of them being behavioral interventions, which is kind of an umbrella term for a lot of what applied behavior, for a lot of behavior analytic interventions in like one spot. So like, for example, discrete trial training and pivotal response fall into that same behavioral intervention section, and those were all found to be established.
Okay, so does your research suggest that ABA is the only accepted treatment or the only effective treatment then?
It does not.
Okay. And then lastly, you mentioned the development of a code, code of ethics, which is great, but it really does nothing if the treatment approaches from the past and the 2 cases that you mentioned historically with ABA, if the code's not being followed or if the code hasn't changed any treatment approaches. So would you say that the code has had an effect on treatment approaches in ABA?
Yes, I would say it has an effect on professional conduct of behavior analysis, because there are ramifications for ethical lapses and for breaches of the ethical code, whether that be loss of certification, being fired from your job, or possibly even legal prosecution if the ethical situation, if the ethical lapse is significant.
Sure. All right, I think that's all the questions that I have for you. Thank you very much. Is there anything that you would like to add?
Not at this time.
Okay, I'll move on then to reviewing my arguments on why ABA is not ethical. So I've pulled up on this screen here. As you can see, I'll just quickly read over this and then go more in depth. ABA views autism spectrum disorders through the medical model and thus treats the symptoms, sort of says that the ASD is a disease or a pathology that needs treated as kind of the basis of the medical model. But it lacks any medical tests for that, which we'll discuss in a minute. ABA does not embrace neurodiversity and aims to quote unquote cure the client. ABA reduces and eliminates clients' power, and ABA is exclusive and can be difficult to implement. So let's break that down a bit more. According to Portway and Johnson, who wrote an article, did a study based on a learner on kind of more high functioning, but on the ASD, the spectrum here, stated in their research that there is no medical test for this. So we're treating it as a disease or a pathology, but there's really no medical test. There's no blood test. There's no DNA test, such as evident for Down syndrome. So on Autism Speaks backs this up as well, which is a great resource for parents whose children have been recently diagnosed, but the first line on their website says no medical test exists at this time. So I guess, why are we treating something as if it needs to be fixed or is a medical or health concern when there's just no basis for that? So the diagnostic tools for this include observation of behaviors, and then certain assessments like the MCHAT and the DSM-5. Furthermore, it treats only outward symptoms. ABA focuses on observable, quantifiable behavior, things that you can see and measure, but doesn't take a holistic approach. With the cancer, let's say, if you're diagnosed with cancer, there's a medical test that shows that. And then the doctors know exactly what to treat. They're going to treat the biology. They're going to treat that disease. They're going to try to rid the body of it. With autism, that's just not possible. We can't cure the person. We don't even have a test that necessarily shows autism. It's just more of a different way of perceiving and processing information. And then back to that observable behavior, if I take, for example, me, if I go up and hug someone, the observable behavior is me hugging someone, but you're not taking into account the kind of the why factor. Why did I hug someone? What was my motivation for hugging someone? My motivation might have been that I wanted to feel love and accepted, which is, one of the things listed on Maslow's hierarchy of needs, the need for belonging to a group and being accepted. But that's not something that can necessarily be measured or quantified. It's not observable. It lacks that intrinsic motivation. So for some of these behaviors that these individuals exhibit, we don't necessarily know why they're doing that. So is ABA really treating the whole person? It's just not holistic. And because of the fact that we lack that biological testing too, is it really fair to consider it a medical condition? As I mentioned, you think of a medical condition as something that needs treated. Maybe autism doesn't need treated. Maybe ABA is taking it too far and just not embracing neurodiversity, which is a new, pretty recent movement among individuals with autism. Children that have now grown into adults and have been through ABA say that they feel disrespected. They feel like they were labeled, that they weren't appreciated for just who they are, and that instead of embracing their differences in the way they think or act or perceive information, they were kind of forced to act a certain way rather than embracing that. And it applies that label too. So if you're giving someone treatment, you're suggesting that they need that treatment for some reason. And that treatment it uses socially significant behaviors. So kind of means that they're different from the rest of their peers. They're different from society, and you're trying to teach behaviors that make them more socially acceptable, which may not be a bad thing, but to do that, you have to acknowledge then that they're abnormal. It applies that label. And in an article by Schreiman in 2016, they talk about how applying labels can be really detrimental. Some effects of applying labels include being ostracized by peers, depression, anxiety, sometimes even leading to suicide, death, and low performance due to that depression and due to a lack of expectations. And teachers know that one of their students has autism, or an employer knows that their employee has autism. They might not expect as much out of that person, and that's almost as a self-fulfilling prophecy. Their performance suffers. It leads them to feel misunderstood, and sometimes that can even lead to abuse and neglect from other people. Additionally, ABA reduces clients' powers. It doesn't really respect that client. An ABA reinforcement is given based on specific behavior criteria. So, for example, you tell a client to clap their hands, they're not going to get access to their reinforcement until they clap their hands. Is that really respecting them? I really like to read, and if I had a book in front of me and then someone took it away and told me that I couldn't read this book until, I do X, Y, Z and exhibit all these behaviors that they want me to, and then they'll give me the book. How do you think, that would make me feel? I'd be pretty upset about that. And even then, when I do get that reinforcement and get that book back, I only have access to it for a couple of seconds. Is that really respecting the client, doing the best for them, respecting their autonomy? It's either do the behavior and receive the reinforcement, or don't do the behavior, but you're not going to get that reinforcement. Is that really giving them a choice at all? And then lastly, ABA is exclusive and can be difficult to implement. Other approaches do have scientific support. Autism treatments in print, media's coverage of scientifically supported and alternative treatments is an article by Schreck, Russell, and Vargas, and it outlines other approaches. Simpson, in his article as well, Dr. Simpson is a professor of special education at the University of Kansas. He's also the senior editor of a journal called Focus on Autism and has 134 research projects a day. I mean, this guy has his credentials. He used the term appalled when referring to the idea that parents and teachers and even some BCBAs are demanding that only ABA be used, that no other treatment be used. He's appalled because there are scientific bases for other treatments out there. And then Kirkham, an independent scholars, suggested that the quality of research from the past is low quality and overstated the benefits of ABA. He talks about the history and kind of the scandals in ABA and how sometimes in the past ABA has included abuse, including the Loves, Dr. Loves in his research. He ended up abusing a client. So can we trust the results of those research? The Institute of Educational Sciences states that there is, and I quote here, little high quality evidence for the Lovis model, and others criticize the lack of randomized controlled trials. So yes, there is research supporting ABA, but what's the quality of that research? And then lastly, it's just ABA is expensive. Somebody has to pay for these treatments, and sometimes that includes too many stakeholders, the client, the parents, and any other surrogates for the client, BCBAs, any school personnel, teachers, principals, insurance companies that are helping pay for this, the child's pediatrician and doctors that might be involved. With this many people involved in treatment, miscommunication can occur. They all have different opinions on what needs to be treated and what should be targeted. And how much are you actually getting input from the actual client? How much are you taking into account what they say? Because everything is more socially significant. So it's clinical settings, doctors and BCBAs and therapists that decide what targets and behaviors to target rather than necessarily just the client. So with a combination of all these factors, there's just too many questions here with ABA. ABA is unethical, or at least, needs more research in these questions to be answered before it can be considered an ethical treatment for ASD.
Thank you, Shannon. So I had a couple of questions. I just wanted to clarify a few things. First, we discussed the medical model and that there's no medical test for autism spectrum disorder. Is the lack of a medical test, does that mean that autism spectrum disorder doesn't exist, or that the behaviors that clients exhibit are not significant, or that families don't deserve services because of that?
Sure, I would say they definitely should be targeted if the client's safety is at risk or others around him. But for some more minor behaviors, it's just a difference in the way they perceive the information and the way they view their world. You know, it's not necessarily something that needs treated just because they're different than somebody next to them, you know. Like with skin colors can be different. That doesn't mean somebody with a darker skin color needs to be treated. I would say that services should be, provided for things that are going to endanger someone. Like with drug use, you provide services to help someone who uses drugs because it's affecting their health. But for less serious behaviors, there's just not a need for that treatment because you're not embracing the client and how they process information. You're needlessly labeling them.
Okay, so going off of the needless labeling and maybe the discussion of socially significant behavior and how it may or may not affect, may or may not need targeting. So I guess my question is that do the socially significant behaviors that ABA targets, like for example, eye contact or the use of requesting, do those things allow access to, facilitate more access and allow access to different environments for people with disabilities who now have those skills?
Sure, I think it depends on the situation. You know, kids in a preschool setting, I have personal experience with, teaching preschool in my past here, and any child is going to go up and take a book away from their friend or a toy away from their friend. So I think that we naturally teach kids this as they develop. You know, just because that person ran up and took a book away from their friend doesn't mean that I need to, enroll them in ABA therapy. That's just something that when those events happen, we teach them in the moment. With more serious behavior, such as aggression or self-injurious behavior, that might require some treatment. But some of these things that are being treated in ABA are unnecessary, like requesting items, as I said, and gave an example with the preschooler. That's something that's just developed as, the individual develops in an everyday life. But some of these other things, like maintaining eye contact, can be really aversive for some of the clients. I'm looking away right now. I'm not looking at the screen. I'm not looking at you, but you're still able to understand my message, understand my words, even though I'm not physically maintaining that eye contact right now. So they're still communicating, they're still getting their point across. So requiring them to maintain eye contact when it's uncomfortable isn't necessarily benefiting them. It can be actually harmful to some of them. So in this case, I don't think that ABA is ethical for forcing a client, because if they don't maintain that eye contact, they don't get that reinforcement. So a big problem is that they don't have a choice in the matter. They don't do it, they're not getting what they want. So it's almost, as if their right to make their own choices is being removed.
So off of access to, you give an example of how to read a book, you have sit down and read it. Who have ABA intervention might not have that ability. I guess my question is, what steps do you have to take before you are able to access reading a book?
Sure, I have to exhibit the behavior of, standing up now, walking over to the book, picking up the book, opening the book to read the book. But I have a choice in that matter. My problem with it is the choice. If I don't want to read the book, I'm not going to go pick it up and do that. If I want to read the book, I'm going to go pick it up and do that. There aren't any other behaviors. I don't have to jump through hoops to get that. I'm in full control of whether I go get the book or not.
Follow up on that. You want to read a book, you haven't engaged in behavior that enables you to buy the book, for example, going to work so you can make money and buy the book. if you don't engage with them when you're going to work, do you then have access to that book that you purchased?
Right. I wouldn't have access if I didn't go to work to have money to buy it, as you said. But again, that's up to me. I have no one standing over me telling me, go to work, go to work, go to work, or with clients like clap your hands, clap your hands, clap your hands. If I don't want to do it, sure, I'll miss out on that reinforcement, but I don't have to do it. With ABA, typically a client always has to do that behavior. We have to follow through so that they comply with the demand. And if they don't do it independently, then we jump in with prompts. And for some, that's even, a full physical prompt. We'll take their hands and clap their hands. So they don't really have a choice even to not do the behavior, because eventually, the therapists keep working with them until they do, even if it takes a full physical prompt.
Okay, and then my final question is, you discussed, you referenced Kirkham, and he is describes himself as an independent scholar. I guess my question is, what is an independent scholar?
Sure. So an independent scholar is someone who just doesn't have the funding through a university. So he took on this project himself. He did a lot of interviews with individuals with autism, most of them who are now adults and had, as I mentioned before, ABA therapy growing up, kind of listened to their opinions and their viewpoints on the matter. His article is still published in a journal, in a peer-reviewed journal. So we know that there's accuracy and there's a basis and credentials and that it's accepted because his peers have reviewed it, read over it, analyzed it, and have approved it for publishing. He just doesn't have the funding through a university like most professors, such as I talked about Simpson at the University of Kansas, I believe it was, who has his funding through the school and is a professor on staff at the school.
Okay, thank you.
Absolutely.
Okay, so I am going to go into the continue with my rebuttal. So I'm going to restate some and maybe discuss some things that Shannon brought up. First, I want to just discuss some things that Shannon argued in her cross-examination with me. So we discussed how labels Shannon, you mentioned how labels can be negative and tragic. Something that is important about labels, though, and specifically relating to autism spectrum disorder and the fact that it is a diagnosis, is that it enables access to services. People are not going to be able to access services covered by insurance if they don't have that autism diagnosis, and that label is necessary. So while the neurodiversity movement might have good intentions, without those, without a autism spectrum disorder diagnosis, families wouldn't be able to access the services, whether it be something other than ABA or ABA. So for example, speech therapy, you can't access that without an autism spectrum disorder. For many people, it can be very expensive to get it privately without that autism diagnosis. So it's very necessary to have those labels. And in a lot of cases, those labels are helpful and beneficial. Another argument I wanted to touch on was that reinforcement. We discussed reinforcement and how you can access how choice occurs. However, reinforcement is dependent on appropriate behavior for all of us. So if, yes, you can decide not to go to work and not make money and not be able to buy the book, but that also limits your choices. I won't then have the ability to go to, if I don't have any money, going to a store is a less reinforcing experience for me because I don't have the money to buy any of the things. So when we don't engage in the appropriate behavior necessary to function in society, it limits the reinforcement that we have accessible to us. And that limits our choices inherently because we are taking away the opportunities. So things that applied behavior analysis provide, when ABA teaches new skills for people with autism, it allows them to access new environments and access different reinforcement. So while reinforcement may be temporarily limited to reading a book, when the client learns the skills on how to go to their job and then make money and have an apartment and then go home and read the book. They then have unlimited access to the book in the afternoon because they've learned the skills, they've acquired the skills through their ABA services. So that is a reason why applied behavior analysis can be ethical in its reinforcement, because it's a temporary control of the reinforcement. It's not forever. Once the skill is acquired that enables the individual to access more environments, they have more access to different reinforcement or that same reinforcement. I also wanted to touch on the idea that applied behavior analysis research is not high quality. I discussed the National Standards Project, and that looked at many, many studies and found they examined them critically and found, like I said, 3 of the 14 beneficial interventions were ABA related specifically, and one of them is an umbrella term, so it includes a lot of ABA interventions. And I guess my point is that the idea that a research study needs to have a control group and an experimental group is not necessarily ethical. To say to a family, you're going to be in the, well, you wouldn't tell them, but they know they're not receiving services if somebody comes into their home and doesn't implement any sort of intervention. And it's not ethical for a student or a child who is engaging in aggressive or self-injurious behavior to have them receive the control group, which might be no services at all when they are clearly in need of services. It's just not ethical. And the research designs that are used in ABA, single subject research design, has things in place, procedures in place that creates a functional relation. You can see it using the reversal design or multiple baseline design that shows the research, it shows the functional relation and the control of the intervention without creating an ethical issue. So this is an instance where applied behavior analysis is more ethical in its procedures. We also talked about the an example of a experimental research design would be the one, a study done on the Early Start Denver model, which is an early intervention. They did a control versus experimental group and found that the Denver Early Start model was extremely beneficial in terms of receptive language, IQ, and other skills for the children who received applied behavior analysis services as opposed to not receiving those services. And then I also wanted to just touch on, again, the Kirkham as an independent scholar. Something about that is that he's a self-proclaimed independent scholar. Someone else didn't define him as an independent scholar, so I have trouble taking anything that he wrote seriously, because there unfortunately are articles that are published in peer-reviewed study or in peer-reviewed journals that just don't stand up to research methods. And that's something that the National Standards Project, as we discussed, it examined many, many research studies and found some of them to just not hold up to research methodology expectations. So in summation, I wanted to just say that applied behavior analysis is an ethical practice. You can look at the manner in which it has an ethical, we can look at, I'll go into more specifically in my summation, but there are many arguments for why applied behavior analysis is an ethical treatment approach, and I'll just summarize those later, but I'm glad to have been able to address some of the questions that we brought up in cross-examination.
All right, thanks so much, Jessica, for that. Some of the things that kind of learned from asking you some more questions, some things that just still concern me is you mentioned the 3 kind of tiers in that individualized treatment for students who are in the least restrictive environment, which we talked about might be in that inclusion. They might be in that mainstream classroom with their peers all day. If their peers see them being treated differently, I'm just concerned that they might treat them differently. They see them getting rewards or reinforcement on different schedules. It might raise a lot of questions. It might make them the target for bullying. They may not be accepted by their peers. So I think a risk to benefit analysis needs to be done in this case is Do the benefits of providing this treatment outweigh the risk that they may be ostracized by their peers or labeled? And then furthermore, you brought up the development of a code, which is great, and it may have had an effect on the treatment, but what's the enforcement for this code? Is the board supervising all of these, BCBAs across the country to make sure that they are really upholding this code? They have committed to it, sure, but are they actually following it in their everyday practice? BCBAs work in homes and clinical settings and nursing homes and hospitals and all these different places, schools. They have lots of clients. So are they following the letter of the law to a T here, or are some of them is there some wiggle room here? Are they all following it? Are all clients being taken care of, or is it just some fancy words on a page to kind of protect our field and say, well, we have this ethical code in place, but what's being really done to enforce it? Are clients always being taken care of? I just can't say with full confidence that they are. There's not a member of the board watching everyone's every move. So what steps are in place for if someone violates this code? What happens then? There's just too many questions here and too many risks. There's a lot of what ifs and risk, and if this happens, and I'm not saying that all of these bad situations are going to happen or that these BCBAs are not going to follow the code, but I don't know if the benefits necessarily outweigh the risk here. There's just too many risks with ABA for me to consider it an ethical treatment.
Okay, so finally, we're going to move on to a summary of our arguments. So I'm going to just go over my first 4 points and then touch briefly on the things that we've discussed in our debate so far, Shannon. So first, ABA supports the public. Second, there are a variety of interventions and procedures within ABA. Third, the use of functional analysis and functional behavior assessment create individualized interventions that are ethically appropriate. And then finally, the history of the field has led to comprehensive ethical codes and procedures. ABA supporting the public relates to the manner in which applied behavior analysis sometimes limits reinforcement, because by creating the way that ABA teaches individuals with autism spectrum disorder new skills by temporarily limiting access to reinforcement, allows for greater access to environments that have naturally existing reinforcement that might not have existed for that student, for that client before intervention, before any ABA services. The variety of interventions and procedures have strong research backing, and that's something that's really important in terms of ethics, because if you don't have a research base, you can't say something is ethical because it might not even work. And that's why the variety of interventions with strong research in ABA are significant. Like I said, functional analysis and functional behavior assessment are individualized. That inherently is ethical because it's not a one size fits all situation. It is something that is fitted to the client for the behavior that they are exhibiting, and it focuses on that function in a way that is measurable and you can show that it's actually working. And then finally, the history of the field has led to a comprehensive ethical code. Shannon, you kind of touched on how ethical code, if it exists, does it go far enough just by existing? Well, there are interventions that exist out there that don't have ethical codes backing them. And unfortunately, there are no ramifications for people who breach those codes. For example, functional communication doesn't have an ethical code backing it. And so the people who are engaging in it took longer for ramifications to occur for the implementation of a not effective, in fact, negatively impacting intervention to stop being used for people with autism. So the use of an ethical code not only sets expectations for professionals, but there are ramifications. You could lose your certification. There are legal ramifications that occur, and the ethical code also calls for behavior analysts to hold each other accountable. So in instances where there is not necessarily specific oversight of a committee, like in an in-home, the supervisors or registered behavior technicians, they have an ethical, they are called by the ethical code to report ethical lapses or breaches. So that's significant. And then finally, I just wanted to pull up my sources and discuss, just so we can discuss that really quickly. So the references that I have here are all from peer scholarly or research articles. They're peer reviewed. Oops, I'm sorry, that didn't work. There we go. So the sources that we have here are from scholarly reviewed peer reviewed scholarly journals, and they are they have a strong backing. I discussed the also discussed the behavior analyst certification board ethics code. That is something that was a source that I looked at in my research, and that's significant since we're discussing ethics. And like I said, these are all peer-reviewed scholarly journals. There are no self-proclaimed independent scholars in my sources. Okay, thank you.
All right, so I'll just review my sources real quick. Let me pull them up here for you. All right, let's see. Let me make sure I get to the right page here. All right, again, all of mine were also published in peer-reviewed scholarly journals, including that independent scholar. As I mentioned, he may not have had the funding from a university, but his research was clear and unbiased and was published in those journals after first being reviewed. And the authors were a combination of research and professors of special education, some specific to autism. So these are very knowledgeable and experienced professionals. I don't think that they would argue against their field and their area of expertise unless some real questions needed to be addressed. Some of them were medical professionals as well that are addressing it from a medical standpoint, since ABA does follow the medical model. And I have a complete list of references on the next slide here. Let me go to this one. All right, so there you can see a list of mine. I also should add that I used information from How to Think Like a Behavioral Analyst from Bailey and Birch, and Ethics for Behavioral Analyst, also by Bailey and Birch, are textbooks for this course. So to review, some problems with ABA is that it follows the medical model and doesn't use a holistic approach. It doesn't embrace neurodiversity and the difference is in individuals and the way they process information. It's exclusive. Sometimes people will just kind of latch on to ABA and disregard all other treatment approaches, and it reduces the client's power. It asks them to perform in a certain way. I apologize, I didn't realize the screen share was still on. To perform in a certain way before gaining access to that reinforcement. So all in all, I think this has been a really great debate. It's been challenging to step back and look at ABA from a different perspective. I've really enjoyed working on this project and working with Jessica. Jessica, is there anything else you'd like to add?
Thank you so much for taking the time to view our debate and for working with me, Shannon. It has been a great collaborative work.
All right, we look forward to seeing your debates. Have a great one.